Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. The main reason why I tried PPARS liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery, but prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery, and after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We are always with you from start to finish.
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP. Tapos siyempre, mga non-healing wound.
Yung sa paa po ni ma'am, paano po yun nag-start?
Okay. Kasi ganito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya, by accident. Right foot niya, may para siyang matang isda lang. Yung maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na. So, hindi niya na nararamdaman na may natapakan pala siya. So, probably, yun siguro yung nangyari. May natapakan siya, nasugat yung paa niya, maliit lang, tapos hindi niya naramdaman. Lumala. So, nagkaroon siya ng lagnat on and off, nakahiga lang siya. So, sabi ko sa kanya, so, anong plano mo? Sabi ko, pa-check na natin yan. So, pina-check namin as OPD. Chinek, binigyan, niresetahan ng gamot, tapos tiningnan yung sugat, binusbos. Pero kapiranggot lang ang tiningnan. Tapos, in-advise na lang kami, linis, at 7 days na gamutan ng antibiotic. After na 7 days, lumala lalo. Yung pinaka-pamamaga niya, lumaki lalo. So, sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang marami ng komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So, yun ginawa namin. Twice a day kami naglilinis, tulungan kami ng husband niya, hanggang ang nangyari, gumanda, pero andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARS. May kamahalan. So, sinugal ko para, kasi kailangan kung hindi mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Ang dati kasi dahil nag-peak yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakitaan ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARS, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce yung mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So, ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So, sa PPARS, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung mo na ako binayaran So, it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko yung wound healing talaga. Nag-granulate siya, gumanda yung circulation, nabuo ng laman, okay? Nagkalaman yung mga paa niya na dating wala. Makikita niyo naman sa picture, di ba? dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARS.
Ano yung ma-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously ha. Despite medyo may konting kamahalan, but then kung titingnan mo naman yung long term na gamutan, mas mahal yun. Tsaka hospitalization. At yung syempre, yung recovery. Yun yung maganda doon eh. Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature, PPARS. And I trust Simply Nature.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si 𝘚𝘃𝘈𝘀 taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, try ko daw itong yung PPAR. Pangalawang gabi, naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talampakan, ganon. Pangatlong araw ko. Parang sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun parang lumabas talaga na ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganon-ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera, siguro mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang maganda ang pakiramdam ko. Yung high blood ko, pag ko, parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo. Kasi sabi ko para para lumakas talaga sa akin ng Kasi nararamdaman ko talaga na maganda. I did normal use of. Ay bukol ako dito sa liig ko. 13 piraso. Umabot na ng 3 cm. Take ako ng PPARS 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka kinakapa ko siya, parang nawawala, parang wala na, hindi ko mahawakan. Hindi katulad ng dati. Salamat, Simply Nature.
Hi everyone! I'm Sheila, and welcome to another enlightening episode of Simply Healed webinar. This program is proudly brought to you by the collaborative efforts of Simply Nature International and Simply Healed Medical Group. Simply Nature is an international distributor of food supplements made from a unique strain of high-grade microalgae known as PPARS. Backed by scientific research, PPARS general health and helping to reverse metabolic conditions such as hypertension, diabetes, and high cholesterol. To quickly recap last week's webinar, we tackled a powerful topic entitled Metastatic Breast Cancer, or MBC, Effective Management Through Immunotherapy. This week, we turn our focus on a deeply important matter because tonight's topic is entitled Managing Chemotherapy Side Effects and Understanding PPAR Pathways. If you're on chemotherapy or caring for someone who is, you know side effects can feel like a second battle. Fatigue, nausea, mouth sores, neuropathy, or brain fog. Tonight, I want to give you a simple, hopeful framework. Your body has built-in control dials called PPAR pathways. Think of them as small switches inside cells that help decide how much inflammation to allow, how to use fuel for energy, and how fast tissues repair. When chemotherapy stresses healthy cells, these dials can help the body respond more calmly and efficiently. Our goal is not to replace your treatment, but to support you so you can stay on track with it. Stronger, steadier, and more comfortable day by day. But what are PPAR pathways? PPAR, or peroxisome proliferator activated receptors, are like foremen on the job site. The PPAR alpha helps cells burn fats cleanly for energy, useful when fatigue is very high. The PPAR gamma, on the other hand, helps turn down the heat of excessive inflammation and supports insulin sensitivity and tissue healing. And together, they signal healthier mitochondrial function, or your cell batteries, and more balanced immune activity. So why might this matter during chemotherapy? Because you experience fatigue and low energy. When fuel use is inefficient, you tire quickly. You also get inflammation and soreness. Chemotherapy can irritate fast-renewing tissues. Metabolic swings in appetite, which is more insulin or more stable insulin sensitivity, can mean steadier appetite and fewer energy crashes, and helping you nourish consistently. And lastly, immune balance. While your oncology team manages counts and medicines, balanced signaling can support a more orderly repair versus defend response in normal tissues. How do we support these pathways safely and practically? First, nutrition. You can keep down small frequent meals, protein at each sitting, and gentle fats such as olive oil, avocado, and fish. Also need high needed. Gentle movement. 5 to 10 minute walk or light stretching 2 to 3 times daily can wake up mitochondria. Sleep routine is also very important. Same wind down time nightly, dark, cool room to help regular or cellular repair. And of course, targeted food-based supports such as PPAR active nutrients from microalgae sources are used by many patients. You are not your side effects. You are stronger than the toughest day of the treatment. With the right medical plan, daily habits, and smart cellular support, through PPAR pathways, many patients find they can keep showing up for the therapy and for life. Take advantage of the AMA portion because there is no questions too small. Bring it down and let's look into a plan that helps you finish treatment strong. The intention of this webinar is to make sure we answer more questions coming from all of you for us to be able to empower you even more in your journeys. So without further ado, let's dive right in. Leading tonight's AMA are highly respected health experts, First off, it's an honor to introduce Dr. Jansen Calalan, a graduate of St. Luke's College of Medicine and a diplomat of both the International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine, currently serving as a consultant at renowned institutions, including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center Las Piñas, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices integrative oncology. We also have a successful entrepreneur and seasoned international speaker who brings deep insight into personal health and success. He is the CEO and founding director of Simply Nature International, and of course, our PPARS expert from Singapore, Mr. Shyan Lim. Good evening, Sir Shyan, and good evening, Doc Jansen.
Good evening, Doc. Good evening, Sheila.
Evening.
Doc, how are you feeling today? Tired or?
Okay.
All right. Sheila, let's begin.
All right. Okay. Well, it's nice to see both of you. Thank you so much for going to be answering the questions tonight. Now, first off, coming from Ms. Delia Lorenzo, is PPAR still recommendable for metastatic breast cancer patients with peritoneal carcinomatosis?
Yeah, of course, no, it's still applicable. Yeah, so depends on what goal you want. So, but as long as the patient can swallow, then no problem. But if the patient has difficulties, then there has to be some tubes or some device that should be placed on the patient first for feeding before you can before the patient can comfortably take in PPARS. Okay. Yeah. So that's the requirement. But in general, as long as the patient can swallow, no problem.
Yep, nothing to add.
Okay.
Nothing to add.
All right. Well, actually, the next question I'd like to throw in was a question thrown to us last Tuesday, all right, coming from Mr. Jose. And the question is, what is the best for enlarged benign prostate?
Depends on what the reason of why the prostate is enlarged. So we have to find out the reason first before we recommend something. So I need more information for an enlarged prostate, because an enlarged prostate can be benign. It can be benign prostatic hyperplasia because of hormones. It can be because of metabolic problems. It can be because of inflammation. It can be because of cancer. So these are some things that we have to consider.
I would recommend that patient go and arrange for a consult with Dr. Jansen.
I agree.
Again, for all the viewers, right, you know, the wonderful thing about what came out from COVID is that telemedicine is now more acceptable and more people use it and more people know about it. For many of our viewers who are from the Philippines, the traffic is back to pre-pandemic days. So I can imagine how challenging it is to go to famous hospitals like St. Luke's or what's that called? St. Luke's is the one like McCarthy Medical. Yeah, correct. Yeah, so depends on where you live. It could be a very tiring thing. The other problem is that when you go for a teleconsult, you may not know the doctor. But here, you can always arrange for a teleconsult with Dr. Jansen, especially as you can tell from our programs, if you're a regular viewer, you know how Dr. Jansen, how wonderful he is and how knowledgeable he is also. So do take advantage of telemedicine. It is something that will allow you to quickly address your issues without much hassle. You don't have any inertia or lethargy to think about going to see a doctor. You can just arrange an appointment and have a good consult from the comfort of your home or even your office if you're working.
Thank you, Sir Shyan. Thank you, Dr. Jansen. Okay, for our next question, thrown through our YouTube channel, coming from Mr. Sodus. This is my first time to attend. May I know if taking PPARS is just for treating cancer? Thank you.
Now let me say this. Okay. No. PPARS is a product that has been around for like 30-40 years. All right, but seriously marketed in the Philippines for the last 10 years. All right. So I took PPARS ever since I was 27 years old. I'm 51 years old this year. I, of course, never had cancer, although my father is a 2-time cancer survivor, throat cancer. So I take PPARS for general health. If you want to take PPARS for general health, all you need is actually our best product, which is also our cheapest product. which is the PPAR tablets. All right, you take it you take it as a superfood. It works wonders for longevity as well, which is anti-aging. And if you have mild diabetes, mild chronic inflammation, even high blood cholesterol, hypertension, it will actually help you solve these metabolic syndromes and keep you healthy. All right, and keep you healthy. So yes, you can take PPARs, and the dosage is very simple. Is 10 micro. I'm a guy, so I'm not so good with like I want to keep things simple. So I just simple dosage would be 10 micro tablets, very very small, like Tic Tacs, right? Every day in the morning, and that should keep you good. That will be as good for you as covering all your multivitamins, but then it does have the additional wonderful effect of lowering inflammation, specifically, right? To also balance your metabolic syndrome. So if you are mildly diabetic, mild high blood cholesterol, all these will go away, right? It'll be managed. And also joint pains as well. Generally, as we age, we will have some joint pains. So that's got to do with inflammation. So yes, you can. And you should. Actually, everybody in our company takes it. Yeah.
That's right. Thank you. Thank you, Sir Sean. Okay, for our next question, turn to us privately by viewer named Mila. Question is, what is the meaning of healing crisis? Please side effect or specific side effects if there's any.
Okay, healing crisis is a general term that integrative medicine or the world of alternative medicine proponents use, no? So the concept of healing crisis are effects of it's basically the body's reaction on the things that the patient is taking to repair or to take as treatment. Okay. So those are healing crisis or healing reactions. So that's the term. No? So some specific healing crisis effects would be a few would be headache, sometimes blood pressure. There can be blood pressure alterations. There can be dizziness, diarrhea. The most common one would be diarrhea. Okay. So yeah, those are the common ones. So when these healing crises are only temporary, they should go away in a few days time, one day up to 3 days time actually. So yeah, that's what you expect from this, no? Yeah, that's what healing crisis is.
Doc, sometimes we hear the term Herxheimer reaction. Is that the same thing, or is it a more specific portion of healing crisis?
Healing crisis is the common term that so it's a term that the doctors
use. More technical
for laymen to lay people to understand. But the medical term for that is Herxheimer reaction. That's the medical term. Now, Herxheimer reaction is not unique to the alternative medicine world, no? That is even in drugs, common in medicine in general, may it be Eastern or Western. So the term Herxheimer reaction was actually it's a term derived from the Western medicine or modern medicine. That's what Herxheimer reaction is. And then the Eastern medicine, I don't know, for a lack of a better term, probably they borrowed it from the Western medicine.
Okay, just to add on to the complete explanation Dr. Jansen gave, I just wanted to highlight one thing positive about the word healing crisis, right? You notice that there's obviously your discomfort will come from the word crisis, but there's that word healing in front. So it's a reaction because your body is healing. All right. So another simple generalization of healing crisis is whatever pains you had will actually you might experience them. So it's like a reverse process of how you got to where you are. So sometimes, for example, okay, let's talk about example. You used to be you are a heavy smoker. Then you take PPARs or you take some detoxing or something that helps your lungs heal. So you notice that you will cough All right. So it's like you never coughed for a long time already because you are now a seasoned smoker. As you repair your lungs become more healthy. It becomes sensitive to smoke again, right? So you cough again. So it's sometimes healing crisis will come in the form of reversing the process you went through to reach where you are. So in that process, sometimes you had unpleasant symptoms. So those symptoms come back. But what Dr. Jansen shared is very important. It should not persist for more than a few days, right? If it does persist more than a few days, please, whatever protocols you're taking, go and see a doctor. It might be good to go and see an integrative doctor like Dr. Jansen, who will be aware that whatever natural protocols you're doing and how the Alzheimer reaction comes about. All right? Yeah.
Thank you. Thank you, Doc. Thank you, Sir Sean, for explaining this one. It's actually a common question. And, you know, people and our patients get to be scared, no, when they feel unusual reaction when they take PPARs as well. Thank you.
Yeah.
And
For example, I have a friend, right? She saw me took powder extract, and then she asked me if she could try it. So we were staying together at Biko, I remember, because I saw the Mayan volcano that night. Yeah, and then the next morning she said her breast was painful last night. And then it was because she had a breast operation before. So her old wound was actually hurting. All right. So this is possibly because the PPAR had activated or stimulated the body to heal, and some old wounds, maybe some parts were not healed properly. So it was reacting to it. So she was not alarmed by it because she understood healing crisis. All right. That's just an example.
Right. Thank you, Sir Sean. I actually just wanted to say that for those of you who wish to have a consult with Dr. Jansen, simply type in how to consult. Our caring HCS, Miss Beth and Miss Irish, will definitely get in touch with you individually. Okay. All right. Well, you actually answered one of the questions privately thrown. Is there any side effects if you take PPAR powder, right? But the other question is, does PPARS powder have the same effect with PPARS liquid?
Dr. Jansen will tell you, and many of the doctors will tell you, the liquid is literally more powerful. All right. Does this mean that the powder is not as good as the liquid? No, I think it's for different users. One real factor is cost. All right, one real factor is cost. So the powder, for most people financially, they're able to maintain the powder longer. So it is very common for patients who have a very serious illness. They may start with the liquid, all right? So to kickstart the body, to start the healing process healed, then they use the extract powder to maintain the momentum, all right? And if, for example, the extract powder, along the way, they needed something stronger, they'll go back to the liquid again, and then go back to the powder once they overcome another milestone, right? So, and the other one is kidney, right? For patients who have CKD or any kidney issues, we normally recommend the powder over the liquid because the liquid has a high phosphorus content, higher. So the powder is better for patients with kidney issues. But of course, if you have a serious issue with your kidneys or cancer, right, then the liquid is still the best because even though it has higher mineral content than the powder, however, it's still safe. It's just that the powder is better because it has a lower mineral content. But then liquid is still the most powerful among all our extracts for healing effect. In fact, it is so fast, even for normal people. So I remember the first time my medical site partner in Singapore, we went to visit our factory in Taiwan. So he is 50 years old, right? So he took the liquid like for the first time, actually. And then he felt energetic the whole day while we were climbing the Sun Moon Lake in Taiwan. So he actually felt the difference in terms of energy level. Of course, it's very costly to use it as a Red Bull, okay? But I'm just sharing with you that yeah, the liquid can see very quick effects for people who are critically ill, especially those who are very weak. As fast as 24, 48 hours, they feel more strength. It's not to say that the illness gets better, but at least on the strength level. So the liquid is really very visible for anyone in critical illness. Yeah. Sheila?
All right. Thank you. Thank you, Sir Shyan. Okay, Doc Johnson, would you like to add anything to that?
Nope. That's
That's it. Okay.
We're
Alright,
taking turns today, Doc.
Oh, wow. Thank you. Alright, so for our next question, coming from Miss Leonila Burion, question is, can asthma lead to COPD? What PPARs can I
Ooh.
use?
These are more just interesting. Never had
good
this
question.
before.
Good question. In general, no.
Okay.
In general, no. But if the asthma is uncontrolled for a long period of time, I mean, yeah, for a long period of time, then it can lead to COPD. So, what's asthma and COPD and the difference? No? So, asthma is basically a hyperreaction of the airways. So, the hyperreactivity, this is caused by excessive inflammation because of the immune system overreacting. So, the overreaction of the immune system leads to excessive amounts of inflammation. The excessive amounts of inflammation will lead to airway narrowing. So you have the symptoms of asthma from that. So that's the pathology behind asthma. So for asthma, in order to treat it, you just have to give the patient anti-inflammatories and things that to suppress the immune system. Okay, so asthma in this sense is reversible and quite fast actually. So for patients who are having asthma attacks, you just give bronchodilators like your salbutamol. Immediately, symptom goes away. So that's immediate relief. For long-term maintenance or long-term management, make sure you manage the gut microbiota. Make sure the gut microbiota is healthy. You have to make sure that the patient's antioxidant system is well provided, so that can be sourced from food. Minimize the stressors. Take in the right supplements. No, so these things. Now COPD is a different story. So in asthma, you have systemic effects leading to airway narrowing. So the airway narrowing is a symptom. There's really nothing wrong with the airway. Okay. In COPD, it's different. In COPD, COPD involves progressive degeneration of your pulmonary system. So COPD is not reversible.
Oh, wow.
Okay, so it's irreversible airway obstruction and lung damage, and COPD usually comes from environmental toxins. Yeah, so it's really the lungs getting damaged.
Permanently damaged.
Yeah, permanently damaged. So COPD is really more common in smokers, patients who are exposed to secondhand smoking or secondhand smoke. Yeah, so occupations who are exposed to smoke. So yeah, so those are the people who are at risk of developing COPD. So think about it, you'll know what professions they are. Okay?
Yeah.
So yeah, that's the difference.
A good news for if you're suffering from asthma, I just want to let you know you can do your research and look for a good acupuncturist, because actually in TCM they can cure asthma. Yes, I use the word cure. Right. So it's very interesting. In different medical traditions, certain things are not treatable or hard to treat it with some traditions, and is easier to treat with others. So this one I know from first person experience, because my cousin grew up with asthma, and then my uncle, who is a really renowned TCM and a neurosurgeon by training from China, actually treated his asthma. So he gave him acupuncture and also Chinese herbs, and yeah, by the time he was 19, yeah, his asthma was cured. Right. He used to have to walk around with an inhaler. So yeah, you do some research and see if that fits you, and if you have anyone qualified near you, you can explore that.
Thank you. Doc, I'm just curious. Can kids catch COPD as well?
No.
I haven't heard of one.
Okay. Too young,
I
or
haven't
does
heard
it?
of one. It's
Is
too
it?
young.
It takes too long. It takes some time to develop it, or
It takes some time to develop, but
or is it because they're still they can repair their lungs?
well, of course, number one, they can repair their lungs, no, and again, COPD happens, no, when the lungs gets damaged repeatedly
over long period.
There are lung diseases that occurs in children, and if these lung diseases gets untreated, no, well, yeah, kids can also develop COPD down the road. Yeah, but I'm not a pulmonologist, but in theory, I assume that they can. Yeah. So it's still a possibility, right? I just don't know if it can happen with cystic fibrosis. Yeah, cystic fibrosis is a lung disease that's generally found in children. So it's a congenital. It's a congenital issue. So eventually, yeah, I think children can develop COPD down the road, no, when they have cystic fibrosis. Yeah,
but it's a great
but
call
I'm
out.
I'm not sure.
Thank you, Doc. It's a great call out to all adults there who are smoking. So please stop, especially when you're around children.
For your kids' sake.
Yes. All right. For our next question coming from Miss Emma, question is, can PPARS help with autism? How, and is tablets okay?
Okay.
No, I am not the expert to answer that question. But as with my knowledge, okay, the answer is yes. Because for autism, there's neuroinflammation. PPARS have omega-3s, very rich omega-3s, especially the extracts. So these, in theory, can help patients who have autism. Probably how they can help, well, with my colleagues who are quite familiar with this, they notice that with adequate amounts of omega-3s, children with autism are more docile. They behave more. So you have less tantrums, in other words. Yeah. So so that's the theory behind it. Okay. But I'm not the expert to answer this question. So the answer is really, I don't know. But this is my current, this is what I know. That can it help? Yeah, probably so.
I will support Dr. Jansen. That yes, we do have patients who have autistic children, and it does exactly what Dr. Jansen described. It helps to calm the child down. Not that you take the tablet and take the PPARS tablet and then the child immediately calms down. I'm not saying it doesn't work like a tranquilizer like that, right? But if the child is taking the PPARS regularly, they will, in general, their moods are a lot calmer. They have less outbursts. All right. Does it treat or cure autism? The answer is no. But is it going to be an important component to treating an autistic patient? The answer is yes. All right, because it will help with the neuroinflammation and it will help the child calm down. This is actually something that is of interest to me because in Singapore, more and more children are autistic. Doc, I also wanted to share crazy statistics. My wife just had lunch with someone who owns a tuition center, right? So she said in every batch of her class, there are like 2 or 3 kids with slit wrist, which means kids are attempting suicide. Wow, yeah, and she said it's the games that they're playing, the mobile games. So I remember last time there was this game called Blue Whale that encouraged kids to commit suicide, something like that. So anyway, parents, please be careful. Okay, now go back to the autistic thing. So this one close to my heart. So I know one doctor in Philippines, two. One is actually a specialist in this. The other one is a very senior orthomolecular practitioner. But let's talk about the one who specializes in this. I've seen his program. He has a wonderful program that helps autistic children. And I was just asking him, what improvements can he see? He said that if the child that he's treating is under puberty, that means have not hit puberty yet, let's say around 6 years old, right? He says 30% of them can actually come quite close back to normal. And then 30% don't improve, but yeah, you can't it won't say that they become normal, and then the last 30% just don't get worse, right? So he said one key puberty. So apparently you can do things to help rewire the brain or improve the I guess the neural connections to improve on the autistic influences. However, he does go, very interestingly, they do treat autism with a lot of brain exercises and nutrition. What the food the kids eat, right? That has a big role in autistic children. And as Dr. Jansen shared just now, one of the mechanisms is the omega-3s. So yes, the PPAR tablets will help, all right? But do go and do more research and find, especially the brain exercises. Apparently, those can really, really help an autistic child, especially when they're young. Before puberty, it could have very drastic improvements. All right. So, hataw na?
Oh, thank you, Sir Shyan. Thank you, Dr. Jansen. Just before we go to our next question, I just want to greet our viewers, Miss Vern Vicen, Miss Helen Kamanayan from Baguio. Hi, Miss Jeanette from Childhouse Manila. Of course, Miss Noemi Veres and Dr. Mary Grace Calalan. Hello.
Oh, your wife is watching you.
And Miss Shirley Calalan also. Hello.
Mom, wow, whole family support. How come my wife is not watching you?
Hi, Mom Jaslyn. Okay. For our next question, coming from Mr. Wilfredo, how can PPARS help aplastic anemia?
Okay. This is a very complex disease, no? So, aplastic anemia, what is it? So
Yeah.
before we answer the question, no, what is it?
What is it?
Aplastic anemia, well, it's anemia. So when there's anemia, there's a low count of red blood cells. So in aplastic anemia, what happens is you have lack of production of blood cells. Okay? So why is it so? Because the stem cells producing the red blood cells are being killed, off. Why are they being destroyed? The stem cells, no, the red blood, the blood cell producing stem cells. Why are they being destroyed? So you have a few factors there. One can be autoimmune. The immune system of the patient attacking the blood cell producing stem cells.
Wow.
So it's autoimmune. Number two, you can have chemicals, environmental exposures killing the stem cells. So one example would be radiation exposure. Benzene is also another one. Benzene is it's a petroleum byproduct. Okay. Number three is genetic or congenital issues or inherited issues. Okay. So now with the third one, you can't really do anything about it because it's genetic. So yeah. For the second, what you have to do is to treat the poison. Okay, give the antidote and pray that the bone marrow or the stem cells recovers. So that's another one. For immune-related destruction, what you have to do is to tone down the immune system. Now, where does PPARS come in here? PPARS would be an adjunct for the treatment of these issues or of these factors. So say for example, if it's autoimmune, then what you have to do is to lower the inflammation, then you can take PPARS there. Okay, so it's an adjunct of the treatment. You still have to take the treatment, not use PPARS as substitute because PPARS would be supportive of the treatment. Yeah. say, for example, it's because of chemotherapy. So that's one treatment of aplastic anemia, or a complication. So aplastic anemia can be a complication of chemotherapy as well, or medication intake. So there would be inflammation present in the body. So you have to help the patient to recover faster. Then that's where PPARs come in. So that's the role of PPARs. It's a support. It's an adjunct to the treatment. Okay. Yeah.
I love what Dr. Jansen just shared. So it's very important that we move away from the idea that only drugs, only natural supplements, right? Now that we understand more and doctors themselves also look into both traditions, then we realize what we've always suspected as patients in the past, right? I'm sure at some point you have asked before, can I have the best of both worlds? And that's the proper approach right now. In fact, there's more than just integrative medicine. It's integrative medicines across different traditions coming into play. And I'm sure in the next 5 years, we might even see the increase of Ayurvedic traditions or concepts, even in Asia, in Southeast Asia, as we go beyond our own cultural integrative medicines. That's why Dr. Jansen is always flying around, right? Even in the Western side, he's now into orthomolecular, which is another subspecialty in terms of nutrition and integrative medicine. So there's so much, and I think that's the way we should approach things right now. So I love what Dr. Jansen just shared. Yeah.
Amen. I agree. Thank you, sir. Thank you, Dr. Jansen. Okay, for our next question, thrown to us privately by viewer named Mary Joyce. So she is taking Cleansing Plus, and she is asking if Cleansing Plus can interfere with her other nighttime medications, because our Cleansing Plus is taken before bedtime. So apart from her medications or nighttime medications are metformin, ashwagandha. Those are.
Yeah. Yes, in general, whatever that is, because Cleansing Plus is a fiber. It's a fiber supplement, so that can affect the absorption of the medications that you're taking. So if you are taking those medications, you can take Cleansing Plus at least 2 hours away from those medications. Make sure it's 2 hours, no? So to allow complete gastric emptying and for the medications to get absorbed properly in your small intestine. So you can choose. You can choose either you take the Cleansing Plus 2 hours before you take those medications, or 2 hours after you take those medications. So you can choose either.
Doc, for such practice, would it be more ideal for the patient to take the Cleansing Plus on the daytime instead of before bedtime?
Yes. If the patient is not taking any medications during daytime, then that's fine.
Yeah.
All right. Okay.
You know, there's actually just for number one, totally understand what Dr. Jansen said, because if I forgot to take my Chinese medicine and then it's near bedtime, I can't take both. If I take the Chinese medicine, I can't take my Cleansing Plus. If I take Cleansing Plus, I can't take my Chinese medicine. Okay. The other one, Doc, just wanted to share also. Is it, when you use Cleansing Plus, is it the same? Like for me, it's almost like on the clock 8 hours. So I can plan for those of you who are regular takers of Cleansing Plus, you or even if you're a first time trier, you can try a few days and see how your body reacts. For me, it's actually like around 8 hours, so I can actually time. So if I take it like at 11 a.m. or 12 p.m., right? I will go at around 7 to 9 p.m. And then, so if you take it like 10 a.m., you actually go at 6 p.m. So you'll be really comfortable to take your night medications after that. Yeah. So this is coming from Sheila.
Thank you, Dr. Jansen. Thank you, Sir Sean. Okay, another question sent to us privately by Miss Mila. Okay, I had BUA prolapse, which I got from giving birth of 8.11 pounds. what can I take so that it won't grow or it won't go out? I don't understand but that's the question.
Yeah, this is an anatomical issue. So there's nothing to take. What you need to do is to surgically repair this.
Wow.
Yeah, because it's prolapse. So the surgeon has to, fix it, fix the wall. Well, perhaps you can do Kegel exercises, but even if you do Kegel exercises and it's, prolapse, there's really nothing you can do about it. Yeah. So surgery would be the one. But the question is, would you be qualified for the surgery? So that would have to be answered by the one performing the surgery. Okay, but that's a definitive treatment for this. The problem is anatomic.
Oh, okay. Wow.
Yeah, repair of the area. That's the one that gets that's being prolapsed.
Thank you, Dr. Jansen. Well, for those of you who wish to have a consult with Dr. Jansen, please kindly type in how to consult. Miss Beth and Miss Irish will get in touch with you through inbox. Okay, for our next question, coming from Miss Camille Tobias, can I combine PPARS powder with soft gel capsule instead of PPARS powder and PPARS plus tablet? Case is breast cancer stage 2.
Okay, I usually don't combine extracts with extracts because it's basically the
Same
same
function. Yeah.
Difference is just the concentration and mode of administration. I would rather combine the extract with the tablets. Yeah, because the tablets is the whole food form. It's minimally processed algae. So it's not an extract, the tablet. The soft gel, the powder, and the liquid are extracts already.
Totally agree with Dr. Jansen. I always use the analogy, the extracts are the key to your car engine, and the tablets is the petrol. Which is more important? I would definitely say if you're sick, right? So it's like if you want to get to a place, your car key is very important. If you can't switch on the engine, you're not going to go anywhere. But if you have a car key, you switch on your engine, but your engine doesn't have oil or the engine oil is not there, so it's going to not run smoothly, then you're going to either damage your car or you're not going to go far. So that's an easy way for you to understand how it works. The tablet is like fuel or engine oil to help your engine run smoothly. The extracts are the ignition key to start the engine.
Excellent. Thank you. Thank you, sir. Thank you, Dr. Jansen. Next question is interesting. It's thrown to us privately by a name Jay. So the question is, what did you change in your own practice in cancer treatment after seeing PPAR data?
What did I change? It became more positive because patients, the patients that I get have positive feedbacks. I mean, they can finish most of them who use PPARs can completely finish their cancer treatment. Yeah, so that's what that's what changed my practice. So more success actually. Yeah, and seeing the PPAR data, well, the way I approach patients and probably on how I digest scientific data changed as well.
Wow.
Yeah. Because now I'm more open to natural products, having biologic effects. So this is way back when I just freshly graduated from med school. Yeah, so in med school we were trained with pharmacology, so that's knowing the mechanism of actions of pharmaceuticals. And there are natural products that we've tackled in med school and even in the hospital, but they are a very small portion. So I'm confident to say that it's 5 to 10%. The natural products that we use. But of course, when I graduated, reality is different from classroom setting, of course. So yeah, so that's what changed in my medical practice, and this was way back already. So actually, Simply Nature PPARS was one of the reasons that made me go into integrative medicine or the non-conventional medicine world. Yeah, so that's so it's really big. Actually, it's a very significant part of my career as a doctor.
Thank
Yeah,
you,
so
Doc.
that's what changed. It's significant. Change a lot.
And what changed for me was that PPAR brought Dr. Jansen into my life. Gave me a lot of headaches. No. Gave me a lot of wonderful experience, you know. And now not only that, through Dr. Jansen, Dr. Grace Calalan has also entered my life, you know. But you know, Doc, I just want to say that it's a really interesting journey. One of the top researchers, his name is Dr. Jhen. He's a World Health Organization fellow. He's the actual pathologist who hunt down the source of SARS, which is the civet cat, right? He is one of the first researchers to take a look at PPARs. So when I spoke to him, we went to his lab. He actually said he did not believe in natural supplements. So I realized, Doc, I actually met researchers. I actually met a PPAR researcher, right, for pharmaceutical. I asked her a question, isn't prevention better than cure? Her answer to me shocked me. She said no. She said no. She said no. She said no. I think as a researcher, she was just so confident in cure. She was like, no, prevention is not better than cure. So I was very shocked, you know, and it made me realize that based on our training and profession, we can have really radically different starting points. Really radically different starting points. But anyway, Dr. Jhen never believed so much in any natural supplements because they research drugs, right? They research drug molecules. But after he did the research on PPARs, he always carries a small bag of PPAR in his bag. So that was a radical change for him also. Yeah, and he also is the one that introduced us to Dr. 𝘬𝘕, who worked for Merck and Co., who then discovered that our PPARs actually contains PPAR agonist. Yeah, so just sharing. Yeah, thank you. But Dr. Jansen, thank you very much for your very warm sharing. Yeah.
Thank you. Actually, I hope that our viewers gets to appreciate that you get assured, no, that the PPAR doctors that we are partnering with are really researching about our products before they recommend it to
Yeah, it's only by proof and evidence.
Exactly. Thank you, Dr. Jansen. Okay, for our next question, a follow-up question from Jay. So, question is, where do PPARs not help? So viewers set the right expectation.
Okay, so I always say this in the webinars, also in the past webinars, no. So if the problem is anatomic, the solution is anatomic as well. So PPARs won't help with anatomic problems. So one example would be if you got your foot amputated, it won't grow back your foot. Okay.
That would be wonderful if it did.
Yeah, so that's one. Number two would be anything congenital. Then it won't, right? It's because the problem is congenital. It's inborn. So what do you do about it? I don't know if gene therapy could even address that when you are out, when you are already formed, right? So those are the two that I can think of right now. But we're talking about the diseases or the conditions per se. Okay, we're not talking about the person here or the patient here as a whole person. Okay, because when we say or when we treat patients, we look at the patient as a whole. So sometimes even if the patient has anatomic problems, there are other aspects of the patient's health wherein PPARs can be used. Okay, so this is a different this is different from the question that this viewer is asking. Okay, so the viewer is asking what conditions or diseases wherein PPARs cannot be used as
correct, anatomical
something
and
supportive.
congenital.
Yeah. Okay. So that's what I'm trying to answer. So an example would be, say for example, what example should I okay, gallstones. So let's
Yeah,
take
correct. Gallstones,
yeah,
common
gallstones. So
question.
gallstones, or kidney stones, the main solution to that would be to dissolve the gallstones either through medication, production of more bile, or you remove them outright. Okay, so that's a treatment. So PPARs cannot dissolve the gallstones, but it can address other aspects of the patient's health, like lowering cholesterol, these things, no, to help the patient overall. Okay, but not to treat the disease itself. Okay, so yeah, I think this is setting the expectations that PPARS is not a magic.
No, it's not. And I want to highlight from Doc Jansen's explanation, right? I want to highlight something very different if you were to see a conventional doctor and integrative doctor like Dr. Jansen, who is also a conventional doctor because he is a full MD, right? Okay, is this that many conventional doctors and especially specialists are very specialized. Specialists are very specialized. They will not see your body as a whole. They will not actually see your body as a whole. And it's very interesting because, you know, you were, for example, where I had a growth in my lungs, and then the pulmonologist will be looking at my lungs, and then she will give me a very strong antibiotic for tuberculosis, right? And then she will say it might damage my kidney because it is a very strong antibiotic. And then she said she has to bring an endocrinologist in. So I do notice the difference between conventional doctors and integrative doctors is conventional doctors tend not to look at the body as a whole. They tend to be quite specialized. That's not true of all doctors, but in general. And they are also, sometimes I find that they are also bound ethically to not comment about areas that they are not specialized in. And I notice some doctors, especially the more formal ones, are very careful not to comment about anything, which to me is it's not a positive aspect. I do tend to lean towards what Dr. Jansen is saying, that we should look at the body as a whole, right? As you treat one disease, you'll be very remiss if you did not look at the other body parts. And for this one, I just want to highlight an actual case, and this is Dr. Alhambra. She used to, she's one of the top pediatric neurologists. She shared with me a story where she was on duty in the evening, right? And then the patient was waiting for her, and the patient had tremendous pain in her brain. All right, so the child was waiting, and then when she came to see the child, she said, "Why did you all delay her treatment?" So the nurses were just saying, "We were waiting for you," because she was a pediatric neurologist. But she said, "But the problem is, the reason why she's having such tremendous headaches is because there is a problem with her kidney." And it's causing the toxicity, which is why her brain was, her head was so painful. And you should have asked the nephrologist to look at her. So I think this is just one example. And she highlighted this to me because she was sharing that when she was in med school, there was a very important article that impacted her. It was an article titled "The Barbarism of Specialization." So that somehow in the process of specialization, sometimes doctors have lost sight of what Dr. Jansen says, right? That a patient is one body working as a whole. So I think we are also moving back towards that, looking at the body function holistically. Of course, your specialists are very important. My own cousin is a specialist for heart implants. He's so specialized. He specializes in implants for gadgets for the heart, so like pacemakers and things like that. That's specialized. And I thought they even specialize in left side of the heart and right side of the heart, right? It really goes very deep, which is really important, especially for surgery, I guess, when you have very unique cases. But in general, it can also be a handicap if you don't if you're not able to view the body as a whole. So I would always advise patients, right? When you see a specialist, it's also good to have an integrative doctor like Dr. Jansen. Because number one, being a full MD, he knows what the specialist is doing, right? He can fully appreciate what the specialist is doing. And at the same time, his eye is also on you, your whole body, multi-functions, your different systems working together. So yeah, just my perspective on health and seeking medical treatment. Yeah.
Thank you. I just also want to add very quickly, I've learned this from our two gentlemen tonight, of course, Dr. Jansen and Sir Shyan Lim. For our patients, please always ask the right questions to your doctor.
Ask the right questions.
It can lead you to the right path. All right. Thank you, sir. Thank you, Dr. Jansen. Okay. For our next
I
question.
think one last question.
Yes. Okay. For our
Yeah,
last
because
question.
we've been doing this for an hour. Wow.
All right. Okay. Very interesting one. Question is, if someone misses a day of PPAR dose, should they double up or just resume the same dosing?
Just resume the same dosing.
Yeah, I would say that too.
Well, if you double up, it won't still do harm.
Yeah, no harm.
No harm, even if you double up. But well, really depends, no? So the decision factor here can be if you find that when you double up, you do develop Herxheimer reaction or
that's true.
side effects.
That's true.
So one common side effect of PPARs is diarrhea. So if you do develop diarrhea when you double up, then just go back to the prescribed dose of your doctor.
Yeah.
So if it so happens that you skip a dose, then just resume the next dose as usual. Yeah. So yeah, I think that's the only thing there that would determine if you double up or just take it as it is, no?
Yeah.
As per usual. So
yeah,
I can think of any other reason.
Yeah, I think it's the same approach with drugs lang.
Yeah.
If you miss your Panadol, or what do you call? You all don't take Panadol in Philippines. What do you take in Philippines?
Panadol is paracetamol here.
Paracetamol, right?
Biogesic.
Biogesic, yes.
If you miss one dose of Biogesic, you won't take double dose the next time, right? So same reason. Yeah.
So it applies for both. It applies for both prescription and also supplement.
Yeah, same
but
logic.
the thing is, PPARS is not a drug.
That's true. No harm.
Yeah, no harm. I mean,
even
if you double up with the PPARS, it won't do harm. It's still good.
That's the good thing.
You're still gonna benefit. But for medications, it's different. For medications, you do not double up.
You do not
double up because that will cause overdosing. So you take the dose as per the prescription if you do miss a dose for drugs, okay, for pharmaceuticals.
Okay, I can think of one reason why some people might double up. For example, if you have pain due to, for example, rheumatoid arthritis or sometimes inflammation thing, and because you miss one day, your pain is
double.
Your pain is actually higher than normal. Like for example, you've been taking PPARs for a month, right? So the pain has really come down, and then you miss one day, the pain is really it really is more than your normal, right? Then you might want to double up so that you have a stronger dose to reduce the inflammation more strongly because your pain is also greater than normal. So yeah, in those specific cases, yeah. But if you're just thinking that, I missed one, I want to catch up, then I don't think no harm, but not really necessary also, especially if it's just one day. Yeah.
And not ideal too. Okay. All right. Well, thank you so much, Sir Shyan. Actually, I'm afraid that's all the time that we've got today. Don't worry, for those questions that we weren't able to answer, we'll have it answered privately or ask them next week on our next event or next webinar. But we're almost at the end of the webinar. As we wrap up this evening, we'd love to hear very quick final thoughts from the both of you. Like Dr. Jansen would like to start.
Yeah, so next month is our Simply Healed webinar in person. So I hope to see you there. So please, please, please fill up our venue. We want it to be packed, we want it to be packed, and it's always very interesting, discussing a lot of things face to face. It's always an experience. It's always an experience. So yeah, I hope to see you November 15, is it?
That's
Yeah,
right.
November 15 on a Saturday.
Right? Yeah, Saturday. So yeah. I'll give the floor to Sir Shyan. So that's it for me. Good night. Good night.
Thank you.
All right. Yeah. Same like everyone. Thank you for joining us, and we would love to see more people live, because it's really engaging. The more people we have, the more engaging it is, because one person's question will lead to another person's question, because everybody in the room has issues. And the more common one is cancer, right? The topic is usually about cancer. So we have a livelier discussion when there are more people with more different angles. So we really look forward. And I said this before, we chose SMX Aura because it's located in Bonifacio Global City. So for many Filipinos, if you have never visited Bonifacio Global City, please come. Right, I'm a Singaporean, yet inviting you to your own nation's city. It is the most beautiful city in Philippines, right? So, in terms of city, not nature, all right? So do come. We chose one of the best locations, and we start the program very early at 8 a.m., is it?
That's
Sheila?
right. Yes, 8 a.m. to 11 a.m.
Yeah, because we got to make time for the Q&A, right? So people usually keep asking questions and don't want to go home. All right, and the reason why I want to start early is so that those of you from the province, you can have a wonderful lunch at SMX Aura. So there are a wide range of restaurants, and Market, which is right beside SMRI, is also there with another wide range of choices for you. So that after that, you can have a safe trip back home without arriving home late. Okay, so looking forward to seeing everybody on the 15th of November on a Saturday. I'll hand the time back to Sheila.
Thank you. Thank you, Sir Shyan. Okay. All right. Well, thank you once again for your questions. And thank you, of course, for considering our program a program of value while you journey with your own health battles. On behalf of our patients, thank you so much again, Dr. Jansen Calalan and Sir Shyan Lim, for putting so much effort and care towards all of our questions tonight. So keep informed and explore our available options. So don't forget to like our Facebook page, Simply Nature International, and of course, Dr. Jansen Calalan's Facebook page and Simply Health Medical Group for those of you who wish to have a consult with Dr. Jansen. And of course, subscribe to our YouTube channel. This is also to make sure that you get updated with our latest promos and events, which I am about to announce. I have a lot of exciting announcements tonight. Please stay tuned at the end of the program. Okay, so first off, as Sir Shyan mentioned, we are inviting everybody join us for the upcoming face-to-face cancer seminar, okay, entitled Defying Cancer Diagnosis, Thriving with Science and Nutrition, on November 15, 2025. That's a Saturday from 8 a.m. to 11 a.m. at SMX Convention Center at SM Aura here in BGC Taguig. Learn practical science-based strategies in lifestyle and integrative medicine from Mr. Shyan Lim and Dr. Jansen Calalan. Get real answers live from the both of them. So yes, take advantage of that moment. Tickets are at 250 pesos. So secure your seats now. You can bring your companion, most especially for our cancer patients who will be attending. You can bring your companion. Register via the link in the description or scan in the InstaPay or GCash QR code on the poster. So bring a loved one, limited seats only. And guys, seats are being filled out. So please, we hope to see you on the SMX Aura on November 15. Now, get ready for the best deals ever because this is exclusive only for the website orders. Yes, because starting last Wednesday, you can now buy your PPARS liquid extract or PPARS powder extract with no shipping fees. Yes, free shipping, guys. So whether you are ordering from Metro Manila or anywhere nationwide here in the Philippines, you can avail this free shipping promo. Once again, this promo is only available via website. That's www.simplynature.asia. So this is your chance to power up your health. Now, amazing, right? But wait, there's more. Just before we end, okay, some few announcements. We are calling our VIP clients, hello everyone, to attend our very exclusive VIP meetup happening next week. That's October 22, Wednesday, and it is very exclusive that it is happening not via Facebook, but via Zoom. And get this exclusive VIP meetup event is actually for free. And get this, exciting raffles and prizes awaits our VIPs and extra exclusive promos like buy any 5,000 worth of products via direct or website and get 2 sachets of Cleansing Plus for free. That's 2 days of detoxing, guys, for free. Now get 3 blisters of soft gel, PPAR soft gel capsules, and grab 5 sachets of Cleansing Plus for free. Wow, it's raining Cleansing Plus, right? Now, and of course, our most favorite and most awaited promo. If you buy a PPARS powder extract jar or a box of PPARS liquid extract, get a free bottle of PPARS tablet. Wow, you're getting free PPARS tablet, right? Now, these promos are running next week from October 22 to 24. So make sure to attend the VIP meetup via Zoom and talk to your assigned client service officers right now. Okay, of course, only the best for our VIP clients. And last but not least, okay, are you already looking? It's already October. I know you're all looking for a healthy gift to your loved ones this coming Christmas. So give the gift of wellness with our Kickstart gift package, which is a 15-day immunity booster, or the Power Pack gift package is a 5-day immunity booster, both 100% natural to support and strengthen immunity. Don't miss our early Christmas promo, because if you buy 8 packages, okay, and you can actually grab an extra package for free. Wow. So once again, for our VIP clients, see you on October 22, Tuesday at 7:30 via Zoom. All right, so next week, all right, we hope to see you on our next webinar, Simply Healed webinar, that is happening on October 23, Thursday. That is once again, same time, same day, Thursday at 7:30 p.m. Okay, so thank you so much for spending your time with us. This is Simply Healed webinar powered by Simply Healed Medical Group and Simply Nature International. Because your curiosity about your health condition and your victories over cancer and metabolic illnesses are what keeps us going. Because here in Simply Nature, we're always with you from start to healing. Thank you, everybody. Good night, and God bless you all.